Tell me when it's live. All right, guys, we've come to another podcast, and welcome to Dr. Jimenez and Crew podcast. Welcome, and you have a family here. We're going to go over metabolic syndrome today. Metabolic syndrome is a disorder that ultimately affects a whole lot of people, and what happens is it actually affects one of the largest populations in affecting El Paso, pretty much in this region. And what we have is, it's not a disease, okay? First of all, it's a combination of presentations that medical doctors and the World Health Organization have determined that are high risk factors in order to have stroke, kidney disorders, and even problems with dementia. But overall, it's pretty much, if you have metabolic syndrome, you really feel crummy. So today what we're going to do is we're going to discuss the issues, and we'd like to at least present it to you so that it becomes useful for you. And the information provided by us is going to be helpful for you or a family member. So if you have the opportunity and if something that you enjoy, please go ahead and on the bottom area, there's a little bell to subscribe and a little bell to mark it so that you could be the very first person to get information in the future when we ever post it. And also, it also gives you the opportunity to present or ask us for things that are important to you in the health-related realm, okay? Now, what we're going to do today, my name is Dr. Alex Jimenez. I have my entire staff here. We're going to go ahead and we're going to present each one of them in different moments. And we're going to do some real interesting dynamics. We'll also have our resident biochemist at the National University of Health Science, who's actually going to chime in, who's going to give us a little bit about foundational biochemistry. This information is going to be helpful. We're going to try to make it as simple but as useful as possible. Now, bear in mind, everything that we're going to be talking about in today revolves around metabolic syndrome. Metabolic syndrome is what the healthcare organizations have determined, as well as the cardiac departments have determined, is that it has 5 major symptoms. Now, you have to have 3 of them at least in order to be classified as metabolic syndrome. Okay. Now, the first thing is to ask, what do you feel? Pretty much you feel like crap. Okay, and it's not really a good feeling to feel this way, but you'll see that if you have of these presentations, you're going to notice that your doctor may give you a diagnosis of metabolic syndrome. Now, the first thing that happens is you have usually a little bit about belly fat. Now, the belly fat that people have, people measure it. Now, for men, it's a belly, kind of like the lonja, the belly that actually hangs over, and it's about a good, I'd say about 40 inches or greater in the male. In women, it's 35 inches or more. Now, that's one of the first presentations. Now, the other presentation is high blood pressure. Now, the high blood pressure that they use is 135 milligrams over deciliter, millimeters of mercury over deciliters, over to determine exactly on the diastolic and the systolic. So the systolic is going to be 135, the diastolic is going to be over 85. Now, that doesn't, again, you're going to notice something. These aren't really extreme ranges, okay? Now, it also, metabolic syndrome, has high triglycerides. Now, the high triglycerides are going to be noted in the blood, okay? Now, one of the things that can be determined early on is high blood pressure, which is also associated with metabolic syndrome. So the other final one is the elevation of, or decrease actually, of HDLs. HDLs are the good fragments of cholesterol. Alexander is going to be, our resident biochemist, is going to talk to us a little bit more about that in the latter part of the show. Now, bear in mind, I've given you 5 things. A, the fat. B, the high blood pressure. C, the blood glucose levels, and also the triglycerides, along with the lowering of the HDLs. The question is how are we going to be able to control this? Now, I'm going to give you some real good basic ways that you can actually control metabolic syndrome. And by the time we're done today, we're going to be able to assess the situation. And even if you have it, you basically will be able to control it. There is rare diseases that you can actually, or disorders, and again, this is not a disease, it's a combination of syndromes or symptoms to collectively be called a syndrome. So metabolic syndrome is one that can be misconstrued. Now, you'll notice that the level of blood glucose is going to be elevated usually over 100. Now, these are really relatively normal numbers that people have, but if they're higher than that, they do create issues. Now, also when you have the belly fat, 40, it's not that much. A lot of people have it. People have also blood glucose levels that are higher than 5.6 on your blood glucose, the A1C. Now, these numbers, along with the 150 milligrams per deciliter of triglycerides, they're all normal. But in combination together, they do ultimately create a scenario that is not favorable to cardiac issues. cardiovascular issues do present as a result. So what we're going to try to do is try to bring down and control these issues. Now, what are the things that cause metabolic syndrome? Well, one of the things is stress, smoking, a sedentary lifestyle, and also even sleep problems and disturbances. Each of one of these we're going to be elaborating in the future podcasts, but we're going to be able to tell exactly what's actually going on in a better way. We also have the issues of inflammation and processed foods. Now, at the core of metabolic syndrome, the main issue is insulin sensitivity issues, along with high blood pressure issues and inflammation. So what are we going to do to control that? I want you to know that every single one of these 5 issues, whether it's blood glucose, high triglycerides, low HDL counts, or blood glucose, they're all relatable to one disorder. It's insulin sensitivity. Insulin sensitivity controls every one of these factors. From if raising high blood pressure, the kidneys actually are controlled by the insulin, causing an increase in blood pressure, and we'll discuss that issue and the correlation of it. So if we can bring ourselves to control the blood glucose, we ultimately have the fastest and the surest way to provide the fastest route to heal and to fix an individual with metabolic syndrome. So let's go ahead about the issues that are going to be resulting from that. Now, as I've got this, we're going to notice that if over a period of time you continue to have a lifestyle that has high levels of these particular 5 factors, you're going to notice that you're going to tend to have high cardiac risks. Now, we have a team here, and I'm going to introduce each one. We have Ken Avon, who's our health coach. Our health coach is the one that's going to be the one that explains to our patients what is going on. I'll bring her in. We also have the clinical liaison, which is Trudy. Trudy is the individual that is going to be able to bring out ask the questions and determine what kind of issues that are appropriate for you. So we'll be discussing those. And we have our resident chief editor, Astrid Ornelas, who's going to be the one that's also explains the studies on it. From all the way from Illinois, we also have Alexander, which we have right. We have in the background. You can't see him, but he's presenting. And say hello, Alex. Can you got them there?
Hello.
All right. So he's really he's out there, and he's going to be able to discuss the issues on the biochemistry side of things, and we're looking forward to be able to explain those issues. Now, one of the things we have to do is go back to the issue of insulin sensitivity. Insulin sensitivity is at the root of all these issues. So what we're going to do is we're going to discuss exactly how insulin can actually be controlled. But what we've learned through the studies, and I'm going to bring in Mrs. Ornelas here to discuss the studies that we have pertaining to how to control blood glucose and blood sensitivity. Astrid, what did you find out recently that actually shows the proof and actually presents the easiest way to control blood insulin and elevate HDLs?
Okay, well, first of all, just as a kind of like as you mentioned, metabolic syndrome, it's a collection of health issues which can increase the risk of developing heart disease, stroke, and diabetes. It's basically it can affect our overall health and wellness. And I've done quite some research, and I found through the National Center of Biotechnology Information, the NCBI, there's a variety of research which basically states that metabolic syndrome, or people with metabolic syndrome, one of the easiest, quote unquote easiest, or one of the best ways maybe out there that can be used to help
restore?
To help restore or reverse metabolic syndrome would be through the ketogenic diet. So the ketogenic diet, or the keto diet, as a lot of people know it best by, it is a low carbohydrate, high fat diet, which according to research studies, it offers many, many benefits towards people with metabolic syndrome. It can help reduce it can help improve or promote weight loss, and it can help reduce diabetes. Basically,
I want to mention right there, I have found nothing faster to lower the blood glucose and actually reverse triglycerides issues and HDL issues than the ketogenic diet. So in essence, if you want to do it fast, it's amazing the speed at which it restores the body back to where it should. What else does this show?
Yeah. So basically, like the human body normally, we use glucose or sugar. It's supposed to be our main source of fuel, our main source of energy. But of course, people who have metabolic syndrome, people who have obesity, insulin resistance, diabetes, the increased risk of diabetes, the ketogenic diet can be very beneficial towards that because the ketogenic diet, first of all, because it is a low carbohydrate diet, carbohydrates essentially turn into sugar or glucose, and we don't want that. Like if people have metabolic syndrome, they have diabetes and insulin resistance. You don't want sugar in their bodies because they produce too much of it. They have too much blood sugar, and but by increasing by increasing the amount of fats that you eat and then decreasing the amount of carbohydrates, you actually keep a low amount. You keep insulin low, and you actually, by eating more fats, you basically what you do is that you make the body go into a state of ketosis.
You know what? Let me ask you something. I'm gonna field this over to right now to Kenna, and I'm gonna ask Kenna, in your experiences with the blood sugar issues, how is it that we contain and we learn to be able to manage someone's blood sugar the quickest, the fastest? What is it that you do in terms of coaching individuals, helping them back?
For coaching individuals, I definitely always evaluate their diet, and the main thing I like to focus on is education, because so many people are not educated about, as Astrid was saying, carbs and how they actually fuel your body. A Big Mac might have 54 carbs and a sweet potato might have 30 carbs, and people don't really realize that they're that different. They only see 20 points or something like that. But the way that the carbohydrate breaks down in the body is huge. And that's why the ketogenic diet works so well, because you're using those good whole carbs that are going to actually contain protein as well. And so it's going to help to break it down slower versus a Big Mac, which is just going to spike your insulin way up.
And what part of the Big Mac is the thing that spikes the sugar? I mean, in terms of that.
Right. So the bread, the carbs in the bread, it actually breaks down differently in your body than a sweet potato would. And so that's what's going to give you that high glucose level. And then after that, you're going to have the fall of the glucose level, which just, your blood sugar going up and down does not feel great. So it's something
I got a question for you. For the sugars, when you ask the types of sugars that you have, you just mentioned right now that the quality of the type of carbohydrate matters.
Yes.
Tell me a little bit about that.
The quality, like I was saying, sweet potatoes, avocados, things like that, they're going to have the carbohydrates that are better for you, meaning you break them down differently than you would faster sugars like sucrose and things like that.
So simple sugars are out, basically, which
Right.
is the reason that, first of all, metabolic syndrome did not even exist prior to the advent of refined foods. So refined sugars have caused this problem. So what we want to do is, sugar leads to inflammation. Sugar leads to triglyceride issues. Sugar, or basically insulin sensitivity issues, are the things that are at the basis of this process. All roads lead to insulin sensitivity in this process. And the organ that provides us with the insulin, the greatest amount, is the pancreas. The pancreas is nonstop. And depending on how the pancreas responds to this blood sugar drama, it really determines the fate of the individual. It will alter the triglycerides. It will alter the blood pressure by having a direct effect of holding sodium in the kidneys. The kidneys, the body prepares it, it retains the sodium, and by nature of sodium, the blood pressure soars. So the fastest way to lower your blood pressure is a ketogenic diet. And this is amazing because it really is simple. It's not that complex. We can go extreme, and I know that our state really had a good research document on that. Tell me a little bit about what you noticed.
Basically, like what Kenna was saying before. A lot of people don't know the difference between what type of carbohydrates they want to eat. Like, for example, like you said, a lot of people will eat a Big Mac and they'll eat that sweet potato, and they don't know the difference between a good carbohydrate. Basically, we want to eat what you call complex carbohydrates, which is it's more like we want to eat like whole wheats, or we want to eat like
Yeah.
good starches, because those the body breaks them down into glucose, into sugar, but they're used much more slowly to where it won't you won't immediately the body won't immediately use them, and then just you'll get that crash, that sugar crash.
Because the insulin spike, right? So it controls the insulin spike. You know what? I want to bring in our resident biochemist here, okay? So our resident biochemist is Alexander. He's got a presentation here, actually, if I can see it there. Let me see if I pop up here. Let me see, click it. And there he is. Alex, can you tell us a bit about what you're trying to explain here on the biochemistry side of things?
So as you guys were mentioning, just in general, glucose is a main energy source, and the way that we use it for the breakdown, its breakdown and energy consumption is called glycolysis. So without getting too much into it, our end goal here is pyruvate, which then goes into the citric acid cycle to be turned into acetyl-CoA. In normal conditions, this is good to have a carbohydrate meal, but when in excess, you produce too much acetyl-CoA. When too much acetyl-CoA is used, you end up inducing fatty acid synthesis, which is induced by large levels of insulin. So by doing so, you have acetyl-CoA, which ends up turning into palmitate. And one thing that Ken was mentioning is that not all foods are of equal quality. So here we can kind of see all the different types of fatty acids. So without going too much into the biochemistry, but kind of just giving you an idea what's going on here, these numbers on the left side represent the number of carbons in a row. And then the numbers to the right of the semicolon are the amount of double bonds. And normally, double bonds don't play a large role until you get into the effect of digestion and the way the body uses these. So by having more double bonds, it's more fluid. So you notice the difference between a piece of lard and olive oil. What's the difference? The only difference really is the amount of carbons and the amount of double bonds. So here we have oleic acid, olive oil, and then if we have some sort of saturated fat, we can see that the difference is large in the amount of carbons as well as double bonds. Double bonds allow for a lower melting point. That's why olive oil is a liquid at room temperature versus fatty acids, and this plays a large role when it comes into how the body uses these types of things.
Alex, are you saying that obviously we all know that the good work of olive oil and avocado oil and coconut oil are the best thing, and this is the reason why this happens?
Exactly. So the more double bonds they have, the more fluid it is going to be within the body and allow for the body to use those fats in a timely manner versus clogging up arteries and creating plaques within those arteries.
Excellent. You know what? One of the things that insulin does, it packs away carbohydrates and energy in the cell. If you do that, what happens with this blood sugar? Eventually, insulin spikes it and puts it in the cells. Eventually, the cell grows, hence the belly fat. That is ultimately what happens. The belly starts gaining the fat cells, and they start getting bigger because they get injected in there. That stuff starts seeping out, and once it can't go in anymore, it ends up in the places like the pancreas. It ends up in the places like the liver. It ends up in the intramuscular tissue, and that's why we have the accumulation. And when you have a big belly, that's what tips off the doctor, not only with the triglycerides and the blood glucose levels, but also the belly fat. And that's one of the things we have to kind of assess. So is this now these fatty acids? What are fatty acids used for typically, Alexander?
Fatty acids are used almost for everything within the body, especially for energy consumption. It's like saying, would you rather be able to go 5 miles or 10 miles?
Okay.
You always want to go 10 miles, right? So gram for gram, fat as an energy source is much more fuel efficient than glucose is, or carbs. So carbs are 4 calories per gram, and fats are around 9. So it's more than double the amount of energy that you're producing from these fatty acids. The difficult part is just knowing which ones are good. So kind of going into the good fatty acids, which are going to be the ones with the double bonds. So, I mean, any plant oils, animal fats, depending on which ones, we tend to want to stay away from large amounts of arachidonic acid, as they tend to cause inflammation responses through the inflammation pathway. But the rest of these are really, really good, especially EPA and DHA. So DHA is actually used within the nervous system. It's turned into nervonic acid, and EPA as well. So getting these marine oils are really, really going to be good for your system, just in general.
You know what? As I understand these processes and I start realizing the biochemistry behind it, bringing it home to this process down to the cellular component, it honors and it shows appreciation in terms of what creates the fatty acid excess. Now, again, what happens as a result of too much of this fatty acids or carbohydrates in the bloodstream? The body tries to store it. It tries to store it in form of fat, and it shoves it into the pancreas, so you get this fat inside the pancreas. If it can't do it there, it eventually puts it in the liver, and like we mentioned, it gets it in the stomach, or that's when we see it as a final thing. So I'd like to kind of take the explanation and break apart one other point, the high blood pressure component. Insulin has a direct effect on the kidneys. Insulin tells the kidneys, look, we need to pack this stuff into the fat. And without getting beyond too much of the chemistry dynamics, you can see that what's going to occur is that the kidneys are going to be commanded to hold more sodium. What we learned in chemistry and in biochemistry and in clinical sciences that the more sodium you retain, the blood pressure rises. In essence, that's how quick the blood pressure goes. So you do that for a period of time, and then you force the collection of atherosclerotic plaques because of the fat that is in there, and they can't go anywhere. You're gonna have a problem in the long term. Future. So speaking about the oils, as Alexander just did, one of the things we ask, well, what oils should not we use? Well, canola oil, corn oil, sesame seed oil. I love sesame seeds, but the problem is that sesame seed oil causes inflammation, as Alex said, with arachidonic acids. So what we got to do is we got to figure out exactly what types of oils we can do. And avocados, as Kenna had mentioned, are a great source of fats that we can use and make things more able to be processed. Our bodies and the old pyramid of diet is really bad because it's heavy on carbohydrates. So one of the things that we look at are maintaining all those components. So we talked about the triglycerides, we talked about the belly fat, how it's put together. And each one of these, I want to point this out again, each one of these, the high blood pressure, which is 135, high blood pressure is not considered high blood pressure at 135. Usually it's at 140. Okay, so why are we using triglycerides at 150 are not considered excessive? You know, HDLs lower than 50 are not considered horrible, but in combination together, if you have all these three of these components out of the five, that's what leads to a preposition of being sick and feeling crummy. Let alone any prolonged period of this will end up leading to metabolic disorders, heart problems, stroke problems, dementias that actually occur as a result of prolonged metabolic syndrome states that are within the individual. I know Alexander, I'm going to ask Alexander, he's got some really interesting dynamics as I want to present right now, and we're going to show his screen right here because he's got some interesting components on what also affects metabolic syndrome. Alexander?
So kind of going into what is, I guess, ketosis, because everyone wonders kind of what goes on. So I kind of got this diagram here that I drew out for you guys. We're kind of ignore the ephedrine pathway over here, but just in general. So what's going to happen first is you're going to deplete any glucose that you have. So the body normally stores around 100 grams of glucose within the liver and around 400 grams within the muscle components of the entire body. So if you times 500 times 4, that's about 2,000 calories, which is your daily limit. So you got about a day worth of glucose always stored within your body. But once you deplete that, your body's going to start looking for other things. In the meantime, it takes a few days for your body to switch over from burning sugar, which is glucose, to burning ketone bodies from fat. So what's going to happen? First of all, your adrenals are going to start releasing epinephrine. Its precursor is norepinephrine, and this is going to cause a couple different things. You're going to get a little jittery at first, and you're going to feel really bad for the first couple days. But then your body's going to start switching over as your brain starts to start using these ketone bodies for its energy source. So as you're producing norepinephrine, these are just like, this is the cell surface here. These are just different precursor markers. So we have B1, B2, B3, and A2. So by doing these, they're going to mark and signal to the GS protein, which is going to allow for adenylate cyclase to activate ATP into cyclic AMP. Now, cyclic AMP is a very important component of degradation of fatty acids. And the cool part is it's actually inhibited by phosphodiesterases. So when people come in and say, why is caffeine a good fat burner? The main reason why is because caffeine actually inhibits phosphodiesterase to a certain extent. You don't want to go too crazy with the caffeine and start doing lots of cups of
Alex,
coffee.
should I have like eight glasses of coffee, or how many? Just kidding.
No. I think one glass of coffee is definitely more than enough. So by having cyclic AMP more active, you end up activating this thing called protein kinase A, which activates ATP, and then it activates hormone-sensitive lipase. Once hormone-sensitive lipase is activated, it begins to degrade. It begins to break down fatty acids.
Gotcha.
Once these fatty acids enter and are broken down, they then enter into the mitochondria, and the mitochondria will then end up producing heat from this. So that's why people who are in ketosis are always really warm. So what do I recommend when people are starting a ketosis diet?
Water.
Keto diet. Definitely water. And as well as I would say L-carnitine. So as we're looking at L-carnitine here, we could see that during fatty acid degradation, you use L-carnitine as the main transporter between the outer mitochondrial membrane and the inner mitochondrial membrane. So by using fatty acids, here's fatty acyl-CoA. After we've broken down these fatty acids, it's going to enter CPT1, which is carnitine acyl translocase 1, or polytransferase 1. It's going to enter and interact with carnitine, and then it's going to turn into acylcarnitine. Once acylcarnitine turns into that, it can enter the inner mitochondrial membrane through these two enzymes, translocase and CPT2, to be broken down back into acyl-CoA, which is the same byproduct as glucose eventually. So then your mitochondria can use these in beta oxidation. One thing to note is you have to drink a lot of water, because people who are going through ketosis are going to be upregulating the urea cycle. So you need to make sure that you pull a lot of water or drink a lot of water throughout the day. I would say anyone who's doing a keto diet, a minimum of a gallon of water throughout the day, not all at once, throughout the day. It's
amazing, Alex, that you put that together, because that makes perfect sense to me, and also explains why people do say when we put them on the ketogenic diet that they do increase body temperature. And the water obviously helps you kind of keep the whole system pumping, because that's what we're pretty much made of. And also the pathways that you indicated, the hydrogen and the water are necessary for the process to occur. Is that right? Yes.
Yes. Okay. There's certain aspects within each of these that they fuel each other. It's all an interconnected pathway, but you will upregulate the urea cycle during ketosis much more than when you're not. For example, everyone's notorious, or cats are notoriously known for having a rancid urine smell. And we have to take a look at that from the reason why, right? So in humans, their urea content in their urine is 3%. In cats, on the other hand, it's anywhere between 6 to 9%. So you have to think about it. What is the only mammal on the planet that is a carnivorous animal that only eats meat? The feline family. So since they only eat meat, they upregulate the urea cycle, thus having more urea in their urine. So if you're only a meat eater, you're going to have more urea. Thus, you need to drink more water to flush it out through your kidneys.
That's amazing, because it explains why we make sure that everybody drinks a lot of water, and then they feel better. And I guess if we don't monitor it right, if we don't do it right, we get that thing called the ketogenic flu, right? And the body just feels kind of crummy until it restores and it stabilizes the blood glucose through ketones. Now, the body can use ketones for sugar as it's known. So one of the things that we do is we teach the people exactly how to go through the process. And I know we got some research articles here, and Steve wants to discuss a little bit about that.
So basically, like Alex mentioned, when people start following the ketogenic diet, we do want to, like he said, we want to make sure that they stay hydrated. But more so than that, I guess another thing that we want to educate people on is that not a lot of people know, we need to store up the body with good fats, so that we can, so that as the body adjusts, so it starts basically burning fat as a fuel rather than sugar or glucose. So we want to teach people what are the good fats that we want them to to basically eat, because we need to store up in these fats so that the body can the body can go into ketosis, and it can go through the whole process that Alex just explained. So
you know what, I'd like to bring Trudy here, because she's the one that actually connects with the patients the moment we do assess someone to have a metabolic syndrome. In terms of the resources, how do you go through the process of presenting? Hello, Trudy. There you can see Trudy. And what we're going to do there is we're going to ask you, how do you bring this? Because she's our clinical liaison, our wellness liaison, and she's the one that basically is going to give us the information that helps the patient in the right direction.
Well, hello. And then this is all great information and, which is amazing that we are able to provide this to the public. And I know this can be very overwhelming for people that don't have this information. So that's where I come in. When people come, either call us or come in inquiring about different symptoms that they have, they don't necessarily know that they're experiencing metabolic syndrome. But, one of their main concerns is their weight gain. Based on their concerns, I connect them. Either primary is with Kenna, and they go ahead and say, okay, well, what are the steps that we have to take? And Kenna certainly educates them as far as, okay, this is your lab work that you're going to have to take. We connect them with Dr. Jimenez. After we know exactly what is their main concern, and we're going to start kind of peeling things apart like an onion to get to the bottom of things and get them feeling better, they're not only going to walk away with the specific results, but they're also going to walk away with, like Astrid was saying, what are the good fats to have? What should I be eating? So they're going to be walking away with a lot of information, but also structure. Another thing that we're offering is that Kenna's always going to be there, to answer any questions, and also Dr. Jimenez, so they don't have to feel overwhelmed with the process as they're going through a better, healthy lifestyle.
You know what? That's one of the things. There's a lot of confusion out there, and I gotta be honest with you. There's a lot of misinformation out there. This misinformation can be categorized as intentional or kind of old, or not. It's just not up to date. With these 5 elements and an individual having 3 of them, it's very important to make it repeat exactly how to fix this issue with the individual and how to change their lives, because there's nothing quicker to change the body than a ketogenic diet. We also have to monitor the individuals. We have to monitor them through the process. Now, we have Ken Yvonne, that she's got some methods that we use, that we employ in the office and are useful for, doctors do this around the country, but it's very helpful in helping guide and allow for a interaction and communication between us, the providers, and the patient. What kind of things do we offer, Kenna?
We have one-on-one coaching, which is great for when you're just starting something out. Like they were talking about the ketogenic diet, you might be confused and there is misinformation. So with this one-on-one coaching, it's great because we can connect through an app that we have, and you just pull out your phone. You can send a quick text message. Hey, I saw that one website said I could eat this, but another said this. Can I have this? Things like that. We can clear up that confusion fast, which can really keep you on track rather than doing that guessing game. We also have scales that connect to this app, which allows us to monitor the water weight that they have as well as the fat that they have. And we can also monitor their activity through a wristband that we can constantly track the steps that they're taking, make sure that they're doing exercise, because exercise is also great to help lower that blood glucose level.
You know, you mentioned that about the monitoring. We do that in the office, along with we send the patients home with actual scales that actually are BIAs, mini BIAs, along with their hand and wrist. We can pretty much, for those patients that want to have a connection with our office, we directly can get the information downloaded, and we can actually see their BIAs changing. We also use the in-body system, which we do a deep analysis of the basal metabolic rate, along with other factors that we've discussed on prior podcasts. This allows us to put together a quantifiable method to assess how the body's changing, and a very quick way of restoring the body back to or away from a metabolic syndrome episodes. It's a very uncomfortable feeling. It really can. There's nothing that destroys the body is these combination of issues at one time. However, it's easy to see that the body does everything really quickly, and it fixes. A ketogenic diet removes body weight. It decreases the fat in the liver. It decreases the intramuscular fat. It restores the blood sugar. It gets the mind working better. It actually helps the HDLs through some studies. And I know that Astrid knows there's a study out there that actually pulls the information up on how the HDLs actually are actually elevated with a ketogenic diet. We have a study here. Actually, you can present it, put it on the screen right there. That I think you found that actually shows that the HDL. Am I correct? And the apoprotein, the lipid part of the HDL, also is raised and activates the genetic component. Tell me about that.
So basically, something that a lot of researchers, something that a lot of healthcare professionals out there, doctors, they often say is that when people have high cholesterol, and we're usually talking about the bad cholesterol, when they have high bad cholesterol or the LDL
Fragment.
It's generally associated with a genetic predisposition. Like according to several research articles out there, if your parents, if your grandparents had high cholesterol, there is also like an increased risk of you having a genetic predisposition to already having high cholesterol. Plus, add that like your diet, and if you follow a sedentary lifestyle and you don't do enough exercise or physical activity, you do have an increased risk of having a higher bad cholesterol.
I'm going to pull the information from. I've noticed that Alexander's pulling something information up here on the screen, and he's actually presenting the monitor where you can actually see his blood glucose and the screens that he's going. Go ahead and put that up there for him. There you go. Alex, tell me what you're talking about right there, because I see that you're talking about the apoprotein and the lipoproteins and the HDL fragments there.
So kind of going into a little bit of everything here. So what happens when you eat something that is going to cause an increase in cholesterol? So first of all is you have these things called chylomicrons that are within the intestinal lumen or in your GI tract, and they have apoprotein B48. The reason they have apoprotein B48 is because it's 48% of apoprotein B100. So it's just a little different variation. These chylomicrons are actually going to bring these in through the body and transfer it into the capillaries using apoprotein C2 and apoprotein E. Once they enter the capillaries, they're going to degrade and allow for different aspects of the body to use them. So I have three tissues here. We have adipose tissue, cardiac tissue, and skeletal muscle. So cardiac tissue has the lowest KM and adipose tissue has the highest KM. So what is KM? KM is just a measurement of the way that the enzymes use. So a low KM means a high specificity for binding to these fatty acids, and a high KM means that it has a low specificity for them. So what are the three parts of the body that use the most energy? It's the brain, the heart, and the kidneys. Those are the most caloric consumption parts of the body just to stay alive. So first of all, the heart relies large amounts on these fatty acids here, and transferring them to the heart uses mostly fatty acids. I think it's about 80%, 70 to 80% of its fuel comes from fatty acids. And to deliver these, your body uses these chylomicrons. So once the chylomicron exits the capillaries, it's already as an LDL. So it has two choices, the LDL. It can be taken back to the liver, or it can switch its contents with HDLs, and the HDLs can deliver them correctly to the proper places. So that's why HDLs are so important, because they deliver them to the proper places in the event that these chylomicrons or these LDLs aren't transferred correctly back to the liver. So why are LDLs so detrimental to the system of our body? So here's a couple of reasons why. So as LDLs scavenge throughout the body, they are seen as a foreign object by our macrophages. Our macrophages are cells that are used for immune response. So the macrophages end up engulfing these LDLs, and they turn into these things called foam cells. Foam cells become atherosclerotic plaque eventually, but what they do is they actually embed themselves within or under the surface of the epithelial lining, causing a buildup of these foam cells here, and eventually blocking the pathways, causing a plaque. So by eating better fats, having a higher amount of HDLs, you can avoid these plaques and avoid atherosclerotic plaques, which will clog up your arteries.
You know what? Actually, the link between atherosclerotic plaques and metabolic syndrome, you've made it very, very clear at this point. And that is the reason why prolonged states of metabolic syndrome do create these disorders. I want to take a moment to thank my entire crew here, because what we're doing is we're bringing in a lot of information and a lot of teams. And if someone has an issue, I want them to meet the face that they're going to see when they walk in the office. So Trudy, tell them how we greet them and what we do with them when they walk in if they feel that they may be a victim of metabolic syndrome.
Well, we're very blessed to have a very exciting and energized office. You're always going to feel at home. We're always going to, if we don't have the right answer at that moment, we're certainly going to research. We're not going to toss you aside. We're always going to get back with you. Everybody gets treated as an individual. You know, each vessel that we have, it's unique in its own way. So we certainly don't create a cookie cutter approach. We're always going to make sure that, like I said, you walk away with the most and the valuable informed option for yourself. We're just a phone call away. We're just a click away. And, you know, don't ever feel that there's not a reasonable question. We always want to make sure that all the questions and concerns that you have, they always get the best answer possible.
Guys, I want to tell you thank you, and I want to also share with you that we happen to be in one of the amazing facilities. When we do, there's exercise involved with returning the body back to a normal state. We function out of the Push Fitness Center. We're actually doing the podcast from the fitness center, and you can actually see the information here with Danny Alvarado, and he's the one that, or Daniel Alvarado, who's the director of Push Fitness, who we work with a bunch of therapists and physical therapists to help you restore your body back to where it should be. We look forward to coming back, and like I says, if you appreciate or you like what we have here, reach down on the little bottom, hit the little button and hit subscribe, and then make sure you hit the bell so you can be the first to hear what we got to go on. Okay? Thank you, guys, and we welcome you again, and God bless. Have a good one. Awesome, guys. You did really good. A little shaky in the beginning, but you know we're getting better. I got to tell you.